Aloha. I am Deborah Peters, co-director of the Pacific Basin Telehealth Resource Center, based at the University of Hawaii at Manoa. There are 14 telehealth resource centers funded by the Office for the Advancement of Telehealth in the Health Resources and Services Administration, also referred to as HRSA. We are one of 12 regional telehealth resource centers. Our geographic area includes the state of Hawaii, the Pacific Island territories, and the freely associated states. This covers an area larger than the contiguous 48 states. There are two national centers, one for policy and one for technology. The latter, the Telehealth Technology Assessment Center, which we call TTAC, has asked me to discuss video platforms for use in telehealth applications. Video teleconferencing is probably the one technology that is most associated with telehealth. When video teleconferencing was first proposed as a method to deliver healthcare services, the primary option was to invest in a dedicated video conferencing system, which housed the hardware on site. This investment typically required an investment in IT services as well to support and maintain the equipment. These were rather expensive endeavors, and usage was typically limited to fixed sites such as conference rooms. This meant that busy clinicians had to leave their offices to use video systems. For these reasons, the early adoption of these platforms for healthcare was limited. A growing number of cloud-based video services offering healthcare compliant solutions have significantly reduced the obstacles to incorporating online video communications for the delivery of telehealth services. The only required equipment is a desktop or laptop computer with a camera and a microphone. The typical office computer system is now powerful enough to run the live video software. Additionally, the cost of these platforms and the required equipment has dropped dramatically. From a technical point of view, services can be provided from almost anywhere there is access to the internet. More recently, video vendors have been offering video as a hosted service, either completely or in tandem with on-premises hardware, taking on the task of managing the video servers themselves. For many healthcare systems, this approach offers a cost-effective way to incorporate video into operations without having to assume the task of hiring IT staff that are trained to manage the complexities of video hardware. Any organization looking at an initial or additional investment in video technology should first identify planned uses for video technology to include those uses beyond direct patient care, such as administration. Further, in making the decision, the organization should attempt to anticipate future uses as well. One invaluable resource for aiding in the selection of video platforms is the National Telehealth Technology Assessment Center. TTAC has a very comprehensive toolkit specifically addressing video platforms on their website, www.telehealthtechnology.org. TTAC is also available to field your questions on telehealth technologies as well. However, as with the TRCs, they cannot recommend specific products, but they can assist you with generic recommendations, and they can provide you with the tools you need to decide what would work best for your telehealth program.